Hi, Dr. Staci. Welcome to the Integrative Health Coach Success Podcast.
Hi, thank you so much. It's an honor to be here.
Oh, yes. I'm really looking forward to this conversation. You are going to be a guest at the Reimagining Health Summit this October. October 23rd to the 25th is the dates, and it's in Orlando. And we're really looking forward to your chat there. So we're going to get to know you a little bit today on the podcast. You have a great talk planned for the summit, which we'll talk a little bit about something different, but really looking forward to our listeners getting to know you. So if you would, could you share a little bit about yourself? So what you're currently doing in the health and wellness space, maybe a little bit about kind of how you got here or what else you were doing. It seems like there's been several things and several roles you've played. So give us a little bit of an overview and then we'll get chatting.
Yeah, absolutely. Again, thank you so much. I'm such a big fan of Dr. Cabral and all his work. So it's really, it means a lot to be invited to speak to your audience and then to be here right now. So I am Dr. Staci Whitman. I am a triple board certified in pediatric dentistry, integrative dentistry, and naturopathic dentistry. And I have functional medicine training as well. I didn't start out this way, of course. I was very traditionally trained, as all medical and dental and healthcare providers are. And I was a general dentist for many years, and I was very disillusioned and also dissatisfied with my career choice. And I almost left dentistry because I could see that it was really an industry that just dealt with putting out fires and kind of the whack-a-mole principles. You know, we've all heard this before, of course, and we all have our own story. But really working on end-stage disease, you know, a cavity is end-stage disease, gum disease, periodontal disease, and very few are looking upstream and educating and helping get to the root cause and helping connect the body parts. You know, the mouth has been separated, dentistry's been separate from medicine. And we know now they're not separate. It's all connected. And so I just could see my patients weren't getting healthy based on the fact that I was just, you know, doing fillings and cleanings, and I knew there was more. So I thought, well, how do I salvage this career? How do I get more upstream? That's with kids. That's with educating their parents about true prevention, the oral systemic connection, the oral microbiome, optimizing nutrition, optimizing sleep and airway health. And so I went back and became a pediatric dentist. And it's been a slow evolution. I now have a functional dental practice in Portland, Oregon. And I'm actually a co-founder now of the Institute of Functional Dentistry, which will be launching next year. And I hope to get more dentists thinking bigger picture and looking beyond the teeth and catching issues before they're full-blown fires and talking about the rain barrel effect and all of these concepts that I know Dr. Cabral speaks to as well. And so I'm very excited to speak more about this and especially how we can help support and optimize our children.
Yes. Yeah. It's one of those things where if everybody starts talking preventatively, it's such a different conversation than what we're trying to fix or cure or, right. There's just so little financial reward in prevention that I feel like that's, you know, what's been convoluted for so long. But I think the conversation, or at least what I'm noticing in kind of some of the shifts, especially with my own kids and the conversations that are being had as far as how things are connected with, you know, teeth, airways, nutrition, behavior, all of that. It seems like it's coming along. I do live, you know, it's hard to know, right? Like what other places are getting for information based on demographics and where you are in the country and all of that. But it seems like it's becoming a little bit more mainstream in a way, at least. And so hopefully between everything that you're trying to pioneer and, you know, it will continue to shift in that direction because it's, like you said, it's no different than a doctor wanting to just treat the heart or just treat the kidney or, right? Everything is connected. Our mouths are where digestion starts. It's everything that comes before the digestive system. And it's so important to keep it all connected.
It's so important to keep it all connected. And unfortunately, dentistry has always kind of been the brunt of the joke. I think that some of that is deserved, but I do see a movement happening. I see a shift. It's coming from our patients, it's a grassroots measure. It's going to come from the bottom up, in my opinion. Although I will say a lot of the newer graduates, the younger doctors, the younger dentists, I think they get it. And I think it's because many of them, these are like the Gen Zers now, they're dealing with their own chronic health issues because of what's been happening to our environment, to our food, to our air, to our water. And it's sort of, enough's enough. And we need to think bigger picture. And unfortunately, dentistry has been just oversimplified by dentists, that you need to brush and floss and use fluoride toothpaste and you'll be fine, when really it's a food issue. We need to fix our food system. We need to fix the fact that we're indoors all day. We need to get outside. We need more vitamin D. We need to move our bodies more. We need clean water. We need to optimize how we're breathing. These are the issues. It's and the microbiome. And so there's a lot of attention on the gut microbiome. I'm really excited. I'm going to conferences. I'm seeing the oral microbiome being lectured about. I'm seeing booths popping up, selling oral microbiome supportive products. And it's really exciting because it gives patients more control and support. And unfortunately, I just feel so badly for our patients who are doing everything correctly. They feel like they're eating well and their hygiene's decent, but every time they go to the dentist, they have more disease. And it's because we're missing the true root causes of these issues, and we're treating everyone the same. And we need to be looking at patients bio-individually and creating individualized treatment plans based on what their needs are, based on metrics, based on data, based on, running some labs, oral microbiome testing, blood work, gut mapping, oral microbiome mapping. So it is an exciting time, and there's a shift. And so, Dr. Kerbal and your whole group is part of this. And I just appreciate more providers having dentists on to speak of this, because oral health does matter. There are dozens and dozens of systemic issues linked to dysbiosis in the mouth or disease in the mouth. Heart disease, rheumatoid arthritis, diabetes, pregnancy issues, and if we could avoid all of these things, even cancer, if we could avoid these things in adulthood by starting and educating in the kids, that's preventative medicine. And the biggest thing too is food. Like, our food needs to be improved upon. Fix the food, we fix so much disease too. And so that's a big mission of mine, is to work on that mission with the big food industries and educating patients about the foods that really can be damaging to our oral microbiomes in our mouths, which of course also have systemic issues in our gut and beyond.
Yes. Yeah, absolutely. And I think a majority of your talk is going to entail that in Florida, the oral microbiome and all that stuff that you just talked about, which is going to be incredibly fascinating. And we can't wait to hear so much more there. What I would love to do is, it sounds like there's a passion specifically for pediatrics. And like you said, if you start downstream, right now that kind of trickles up. If you can start prevention at an early age, now you're not dealing with a 40-year-old with a mouthful of issues. And so I'm curious, we have so many moms who are IHPs, so many IHPs who deal with children, particularly when it comes to health challenges. When it comes to children's pediatrics and the pediatric dentistry, is there kind of 3, 4, 5 biggest issues that you kind of look to address as far as, whether it be airways or microbiome or, like you said, nutrition? What are kind of some of your hallmark things that you believe to be most influential when it comes to pediatric dentistry outcomes, their health outcomes?
Great question. I mean, I'll kind of bring you through the evolution of a child's life. So it all starts preconception, of course. So I'm also moving toward helping support women getting pregnant, preconception. How do we optimize to support facial development, jaw development, airway development, and dental development? Not all of us have this luxury to clean things up before we conceive, but ideally, if a mom can clean up her mouth and her partner's, the oral microbiome is transferred from the family to the baby. These bacteria are transmissible. So cleaning up your oral microbiome, cleaning up your oral health, knowing your levels. How are you with vitamin D and magnesium and trace minerals? Like, can we optimize the mom? Can we optimize her while she's pregnant? Because that's when your baby's teeth are starting to form, is in utero. So around 17 weeks of pregnancy, your baby's teeth are starting to develop. So if you are nutrient deficient, vitamin D deficient, or have some environmental toxin exposures or imbalanced microbiomes or inflammation or stress, that can impact your child's developing teeth. And also, we know the oral microbiome heavily influences fertility. So I've been trying to work with fertility clinics to talk about oral microbiome testing in couples who are trying to conceive. Once your baby's born, can you breastfeed? Are you able to? Does that resonate with you? If so, that is my recommendation. It helps with airway development. Breastfeeding is the best way to develop the face and develop the jaws so that you're optimized for breathing. And also, obviously that's helping to influence the oral microbiome, the gut microbiome, immune health, hormonal balances, things of that nature too. Then we move to food introduction. So this is why I like to see children around 6 months old. I'm looking for their oral function. I'm looking for, do they have torticollis, or, do they need to see a chiropractor, a craniosacral therapist? Do they have some oral motor dysfunction? Do they have a missed tongue tie? Just some imbalances this way, but then also food introduction. So I want to talk to my patients and my moms and my dads about optimizing that. Ideally whole foods, less of these cereals and fermentable carbohydrates and the ultra processed foods that we've been feeding our babies, many of them filled with fillers and binders and additives. And what are all of those things doing to their microbiome as well? We introduce food, we introduce whole foods. We know the act of chewing is incredibly important for airway development. So in fact, this is why, so ancestrally, we didn't really have cavities. 10, 12,000 years ago, we were more of a hunter-gatherer society. Then we moved to agrarian, and we started milling and processing flours and adding sugar to everything. And so this is when we saw the cavity epidemic, but also we don't chew like we used to. We used to chew 4 hours a day. We now chew 4 minutes a day. Why does that matter? The act of chewing is what grows the face. It grows the jaws. We're shrinking. Our faces are shrinking. Our airways are shrinking. So I want to educate parents on the importance of that. How do we optimize airway and breathing in a child through food? Now, unfortunately, we're battling against epigenetics and generations of this. So you can do all the right things and still your child may have airway issues, but it's important to know about. So, our food choices matter, and trying to stay away from ultra processed foods. We then want to be doing airway screenings. If your child is mouth breathing, open mouth posture, if they have sleep talking, sleepwalking, prolonged nocturnal urinesis or prolonged bedwetting, spinning around in their bed. Are we starting to see behavioral issues at schools? The teacher is suggesting now your child might have ADHD. I want to know, how are they sleeping? Are they sleeping optimally? Are they getting into deep restorative sleep? Deep restorative sleep is where children release really important hormones, growth hormone. The lymphatic system, we do cleansing of the brain. We remove toxins from the brain. How are they sleeping? How are they breathing? This is very important to catch early. So this is a big part of the conversation as well. You notice they still haven't mentioned hygiene. I mean, hygiene is important, but if all of these other boxes are checked, it becomes less important. So I want to make sure children are vitamin D optimized, their magnesium optimized, their trace mineral optimized, their calcium and phosphorus optimized, because these are all the components that are necessary for dental development and skeletal development too. Then we get to hygiene, and we go over tips and tricks for hygiene. Flossing is incredibly important. So many parents are brushing, but they're not flossing. And I want you flossing from a very young age, as soon as teeth touch. And that can be as young as 2.5 years old. Why? because these ultra processed foods, these goldfish crackers, these chips, these granola bars, these pretzels, they get wedged in the grooves of the teeth. They get shoved between the teeth. And these are the foods that feed the pathogenic bacteria in the mouth, the anaerobes. And so if we are eating these foods, which, it's modern day, we're busy parents, we do the best we can, but ultimately your child will probably be exposed to some of these foods. If we're not flossing, it's going to just lead to so much issue between those back molars. So we do really like to emphasize hygiene. It's really important to talk about what are we putting in the mouth for oral health products. There are things, ingredients that can be damaging to the oral microbiome and actually exacerbate issues. So emulsifiers and surfactants like SLS, sodium lauryl sulfate. Believe it or not, essential oils are antimicrobial. They're not selective. So they can be killing bad bacteria, but good bacteria too. We need to move and shift away from this idea of carpet bombing the mouth, like killing everything. We really want to be nourishing and supporting the microbes. And that goes with gut health too. So how do we do this? We emphasize eat a rainbow foods. We talk about prebiotic fiber. We talk about probiotics, like can we get your kids to sip on some sauerkraut juice and eat sauerkraut or naturally fermented pickles or kefir? These are all really important. And so, and then, I do speak about fluoride, my concerns with fluoride too, whether we want to dive into that or not. But aside from the concerns with toxicity, it's important to know, and no one's talking about this, fluoride is antimicrobial. It's not selective. So again, it can be killing bad bacteria, but it's also damaging our good bacteria. And then what is it doing to our gut health if we're ingesting that all day through water fluoridation or supplementation? It's the same idea with like pesticides, it's killing microbes. What is that doing to this beautiful microbiome and that we know is so important? So there's just so much education that goes into those first few years. The first 1,000 days of life are so important for health establishment in our children. So that's why I really like to see kids at a very young age, and it's really for education.
Yes, absolutely. I think back to, I knew so much when I was getting pregnant with my kids, but this whole oral thing was something that just was not on my radar. I thought like, as long as I wasn't deficient in folate, my kids wouldn't have tongue and lip ties, and all three of them had tongue and lip ties. And, my middle has all sorts of airway issues. She's got this little tiny palate, but I had a little tiny palate, and it really makes for preparing really alleviates you from needing to solve so many problems down the line too. I think that the preparation can sometimes feel daunting and it can feel tedious, but it also kind of clears your path for perhaps at least the possibility for better outcomes. And with that education, it can be so important. And I wanted to touch upon one other thing that when you were talking about nutrition and kind of less chewing. I mean, the pouch, the whole like pouch, I don't know if we're going to call it an epidemic of the whole. I mean, there's companies that are putting grass-fed beef with like vegetables, and I think it's the Serenity brand. Yeah. It's great ingredients, and people are thinking that they're doing something really good for at least what the kids are consuming from a nutrition standpoint, but no one's talking about the fact that they're just sucking it out of a tube rather than actually chewing it. And it sounds like it can have, profound implications as far
for oral development, but also gut health too. Yeah. So, if we're not chewing, it's not only impacting oral development and facial development, but gut health. You're taking away all the chewing sends cues to our brain, which sends cues to our gut to start the digestive process. And so how is this influencing our gut health? The other thing too, functional dentistry really is looking at the mouth as a window into the body. So I can see a lot about the gut from the mouth. I want everyone to think of the mouth as part of the gut. It's the beginning of the gut. So if a patient comes in and they have a lot of oral ulcerations, I don't just ignore that. I don't just say, well, it must be stress. It can be something in their products. Is it sodium lauryl sulfate, or Is it Crohn's disease? Is it celiac? Is it some sort of intestinal permeability issue? Dried, cracked corners in the mouth or burning tongue. There's just so much, even puffy, inflamed gums. These can be signs of nutritional deficiencies. And to your point about the education, it's also important so parents don't feel guilt and shame. I think that's hugely important. There's so much anxiety and guilt and shame from parents, especially mamas, that come in my office and their kids have cavities or oral disease, and they put it on themselves. And this, I just want to emphasize, this is bigger than you. This isn't because you haven't been brushing your kids' teeth. This is bigger than you. And so what we want to do is just get educated. We only know what we know when we know it, and learn from it and make adjustments and tweaks, because we're lucky that Mother Nature has given us 2 sets of teeth. I really like to emphasize this. So I call baby teeth practice teeth, and I have colleagues that roll their eyes at this, but I think it's important to say they're important, but we get a redo. So, which is really empowering, I think, because not enough people are educating us on these principles. Not enough doctors are speaking about it. Pediatricians aren't, dentists aren't. So where are parents getting this information? To your point, so much of this is so new. Some of it is new to me, and I went to dental school. Like, I had to seek out this extra education about the oral systemic connection. I had to go take functional medicine classes to understand the connections, and they're profound. They really are, and we're learning more and more about it. So I just really want to emphasize that I think everyone's doing an incredible job taking care of their babies, and that you just use the tools as they're presented to you to make changes and improvements.
Yes, I love that you say that, because with more information, I feel like can oftentimes come the feeling of more responsibility, and with more responsibility comes the potential for, that mom shame and guilt. And if I had only done this, that wouldn't have happened, or how could I have not known that? And it really is, I think that's probably where it certainly is where my passion for education comes from, but it's probably where your passion for educating parents and other professionals, because once we know better, we can do better. But until this information is mainstream enough, it's really hard to, like you said, it's bigger than us. It's hard to go up against so many of the things that are in our environment and our food sources in everywhere, right? Which I think, let's dive into a little bit about what you brought up, fluoride.
Yeah.
And before we started recording, you had told me that just last night they made a huge ruling on the fluoridation in water and what that's looking like. And, I think a lot of people in this industry probably have known for a long time, like, let's not do the fluoride treatment at the dentist office or see a holistic dentist, but that's only a very small portion, right? What about the fact that it's in our water? And since you're kind of really up on the latest ruling, why don't you give us a little bit of an overview as to kind of what was established last night when your episode airs? It would have been just about a week ago. And let us know a little bit about what happened.
Yeah. So it's a federal lawsuit. It's essentially the people versus the EPA, the Environmental Protection Agency. And it's been ongoing for about 7 years. So it is a huge moment for us who have been speaking out against water fluoridation to have the ruling and have it come back as it did, where the judge said that it does pose an unreasonable risk to our children's health, to our citizens, based on the current water fluoridation practices. What's interesting is a few weeks ago, the National Toxicology Report from the Department of Health and Human Services was re-released. This report's existed for, I believe it's 6 or 7 years, kept sort of under lock and key. When you start seeing these things, it sounds far-fetched and like a soap opera, but this is all true. So the federal judge, under the Freedom of Information Act, said, I need to see that report. The report said there's basically no safe limits based on data right now. They retracted. The American Dental Association didn't like this, so they pulled the report back, made some edits to it, and re-released it a few weeks ago, saying basically the same thing, but just watered down a little bit. So we were hoping this is what the judge needed to make his ruling, and I think we were right. So it's really monumental. And what's interesting is based on the NTP report a few weeks ago, it had said that at 1.5 milligrams per liter, hang with me here, there's some numbers, that there are known neurotoxic effects to children's IQ and neurocognitive issues. That was sort of the main point. Right now, the United States fluoridates at 0.7 milligrams per liter. Okay. But if you dig deeper into the report, it says issues were also seen at 0.7 milligrams per liter. So the American Dental Association chose to ignore those paragraphs of information and said, oh, well, okay, so we don't fluoridate at 1.5 milligrams per liter. We fluoridate at 0.7. So it's safe. And this is what all the dentists have gone wild with over the past few weeks because no one reads anything. Right. So this is just a huge moment because the judge says, no. Actually, based on all this data, all these testimonies from experts at 0.7 milligrams per liter, we are seeing neurocognitive issues and IQ issues. And at this point, the risks outweigh the benefits. There's unreasonable risk. He's now putting it in the hands of the EPA to make amendments. And he says very clearly, the EPA cannot ignore this ruling. So what is the EPA going to do? I don't know. I mean, the cynical part of me says they're probably going to just propose to lower the limit again. The problem with that is there's no safety data on any limit. We haven't shown any limit of water fluoridation to be safe. And also there's no efficacy data. So who knows if that would even work? Or they could rule to ban it and remove it completely. I mean, I hope that's what happens. We shall see. I will tell you there will probably be a lot of lawsuits, rightfully so, because they have known about this for years and years and years. The other issue is we know, they teach us in dental school now, fluoride doesn't work systemically. It works mostly topically, toothpaste, rinses. So if you really want to use it topically. However, the caveat is it is now defined from a federal judge. You know, we have a legal precedent that it is a neurotoxin. So are you comfortable using a small amount of neurotoxin in your children or in yourself a few times a day because of the rain barrel effect, which is what Dr. Cabral talks about? Fluoride is cumulative. We don't excrete all of it. Children sometimes only excrete up to 20%. And adults, 50%. Where is the rest stored? In calcifying tissues in the body. That is our teeth, our bone, our pineal glands. It competes with iodine in the thyroid. And if you get too much of it, it can make your teeth weaker, more brittle, and more susceptible, make your bones weaker. I mean, there are links now to cancer, all of these things. But unfortunately, so much of this does not get released and discussed to the public because I think people are truly worried about litigation, if I'm to be very honest. So it's a monumental moment. And so for anyone out there who's been speaking out with just even curiosity or skepticism about water fluoridation, I think this is very validating. You know, we not only have a scientific precedent, there's over 70 studies showing concerns with systemic fluoride and neurocognition and IQ. That's just neuro. We're not even talking about thyroid health and other issues. I just hope everyone feels confident now that it's you can be louder about this. And then the conversation about toothpaste, that's going to be a personal choice. I personally don't want to use a neurotoxic. Less is more. I'm trying to eliminate toxins from my life and certainly my children too. So, and there's better alternatives out there now. We know hydroxyapatite, it's biomimetic, it's calcium and phosphorus. If you make sure that you're sourcing from ethical, optimal brand, which most, brands now are using optimized hydroxyapatite, it actually is outperforming fluoride. But the whole premise of this is we shouldn't eat anything if we're eating and breathing properly. But, enemy is the perfect is the enemy of good, and so we do live in modern society, and sometimes we do need remineralizing agents in our toothpaste. What I really want to emphasize, though, is no one is getting cavities because you're not using fluoride. That is incorrect information. That is a Band-Aid. This is like if you have a headache every day and you take ibuprofen for it, and then you don't take ibuprofen, then your headache comes back, and people are blaming the lack of ibuprofen. Well, why are you getting a headache every day? Your cavities are not from lack of fluoride. They're from something in your diet, oral microbiome imbalances, reflux, extra acidity in the mouth, how you're breathing. There's a long list, nutritional deficiencies. Something else I want to mention, I'm circling back to mom guilt. So many moms are told your breastfeeding has caused your children's decay. This is not true. It is shown in the science that breast milk does not cause cavities by itself. So many children now are being born with under-mineralized teeth. It's called enamel hypoplasia. In my opinion, it's a silent epidemic. I'm seeing it more and more in my office, as are colleagues throughout the world. Why? I believe, and others agree, it's because of our mineral deficiencies. It's because we are vitamin D and K2 deficient, and microplastics. And this gets really overwhelming, but I think knowledge is power. So microplastics affect hormones. Hormones initiate enamel formation. Those microplastics are affecting the development of your children's enamel. So when they come in, they're weak. Enamel is the hardest substance in the body. It's supposed to be. It's supposed to be naturally acid resistant, so that when we eat and the enzymes come in to drop the pH to start digesting our food, our teeth are protected. And then our saliva further heals them. If your teeth are weak because of mineral deficiencies, because of microplastic, and you add breast milk and maybe you add a pouch, perfect storm. So parents are getting blamed for something much bigger than them. And not enough people are talking about this. So it is something that keeps me up at night. Our kids' teeth are not developing properly. And so what do you do with this? Again, you double down on nutrition and optimization when your kids' adult teeth are forming. And those are from the ages of basically birth up until 10 years old, as best as you can. In childhood, we really want to focus on optimizing our children so that their adult teeth come in healthy and strong, and they're not in the dental chair all day long.
Yes. Yeah. And oh my gosh, it's so much like valuable information there, but going back to, again, the education piece of, and it all starts with like the soil, right? Soil is so depleted, and then our food is depleted. And if you're not even, forget it, even if you are eating fruits and vegetables and good whole foods, that's not even as nutrient dense as it used to be. Never mind under eating that and overeating processed food. Now you're really behind the 8 ball. And this is why with IHP and, so many clients, like we just really emphasize foundational, like get your foundational nutrients up, make sure you're not deficient, right? Everybody's health is kind of the outcome of their toxicities and their deficiencies. And sometimes correcting deficiencies is so much more important than even tackling the toxicities at first, because if you're deficient, your body's not functioning optimally to even handle the excretion of toxicities, right? And so being foundationally deficient as a mom and then getting pregnant and, looking healthy and, appearing like everything is fine, right? But not knowing that internally, hormonally and nutriently you're deficient. Right now, it's just getting passed on. And I think there's a lot in the, IHP community and in health and wellness. There's a lot of talk about getting rid of toxicities. I think more so than correcting deficiencies. And I love that this is part of our conversation, because I've always actually thought of it as the former too.
I totally agree with you. Yes. How can we excrete toxins optimally? How can our immune system even deal with these exposures if we're not optimized? And test, don't guess. I mean, I know functional medicine gets the side eye because we like to test so much. How do I know what's going on in these kids if I don't get a vitamin D reading on them? Do you know how hard it is to get a pediatrician to get vitamin D test on a kid? I mean, it's outrageous. And vitamin D is significantly linked to cavities. So I've done little case studies in my office where, I unfortunately have to put some children under anesthesia. So it's really easy to do a blood draw or a finger prick test. And we test almost 100% of them are vitamin D deficient. I'm talking single digits or in the teens. How would we know that? How is that impacting their other hormonal processes, their immune health, their sleep quality? I mean, it's just so much bigger. And so it's just empowering parents to be advocates for their kids. Information is good, and I agree. Like, there's also so much controversy now with supplementation. What's the alternative? We can't be purists here. It's, people are saying, well, kids should just be outside all day. That's not realistic for everyone. And even if you are, you still can be vitamin D deficient because you're just not good at converting it or, making it bioavailable. So like, we have to be realistic and meet our patients where they're at, and so for me, I just want to get the kids optimized, nutritionally optimized. And to your point, it's hard. I mean, I think you have to eat 5 oranges to equate what the vitamin C that an orange used to have 100 years ago. I mean, don't quote me on that, but it's overwhelming, but this is why I advocate for information, and so you just chip away at it as you can. And you try to work with providers who are really there to help support you and guide you and coach you.
Yes. Yeah. And that's where I love the quantitative data too, because it empowers parents or it empowers an adult, right? Depending on who's getting the information. But it's hard to look at a kid and go, oh yeah, they must be vitamin D deficient, right? But if you can show them a quantitative lab that's like, look, this is where your child's number should be, and this is where they are, or, a gut microbiome test, right? It's so much more empowering to see the personalized, individualized data that then is like, oh, okay, I can see a problem versus just conceptualizing a problem. I think
it's sort of health coaching. What good health coaches use this to help the psychology of motivating patients, because again, this can be very overwhelming, but nothing is more powerful than a mom with knowledge. I will tell you that. So, but she needs the knowledge. And I don't mean to just single out moms, dads too, of course, but parents in general. We all want what's best for our children. And I'm just really tired of patients getting blamed for their health issues. I think that's lazy of providers, and it's the whole principle is do no harm, and to me that's emotional health too, and that is looking at the patient as a human being. And dentists particularly are pretty terrible at this, like very focused just on the teeth and not on the experience of the patient, the experience of the family, the emotional health, the phobias, the fear, the guilt, the shame, the embarrassment that goes around with dentistry and dental experiences. I think it's the most important part is mental health. So yeah, information's important.
Absolutely. Yes. Because once you have the information, then you can be empowered to do something differently. And I love that there's so many times where I've gone to appointments with my kids and I've been just more anxious to hear about like, how did I mess up this time? Right? Like, what is the problem? Where did I go wrong? What did I not look into enough? And I think any parent listening is going to feel extremely validated and really drawn to your approach to not further guilting, shaming, and supporting the whole dynamic of right? Because I've gotten agitated, right? With conversations with providers, agitated myself, not with the provider, but I've left appointments and I've been agitated. Now my kids are experiencing my agitation and anxiety around the issue. And that's not good for them. Right. So
emotional health is transferable. I mean, that is absolutely true. And unfortunately, so many of us have had our own terrible dental experiences and shame around our own teeth. And we really want to try our best not to put that on our kids too. Their narrative can be different.
Absolutely. Yes. I think that we could do a whole podcast on that alone. I love your approach there. Well, anybody that's coming to the Reimagining Health Summit or who's bought virtual tickets and gets to hear you speak is going to be extremely fortunate. You're really brilliant, compassionate, passionate, and we're all really grateful that you were here, but also really grateful that you're going to be in Orlando on October 23rd and through the 25th, and that we're going to get to hear you speak live. So I appreciate you being here and sharing everything that you did with our listeners. Where do you show up on social media? Where are all the places that people could hear more or connect further?
I do. I'm mostly on Instagram, Dr._Staci. Doctor is spelled out DOCTOR_STACI. I make appearances on TikTok. I'm building my YouTube channel right now. These are all the same handles. I have a website, drstaci.com. I'm actually launching when this airs, probably a week, online consultations now. So I will either do second opinion email consultations on x-rays. We'll do one-on-ones to talk about all the educational components. And then I actually will be having a tier where I'm going to be I can offer to run labs on your kids for you too and review those with you, because I know most dentists aren't doing that. So I'm excited about that. And then I have other courses and handouts and education and blogs and things on my website too. I really do try to answer all my DMs as well. I do the best I can. So I want people to feel like they have access to me. So you can always hit me up, especially on Instagram, in my DM world. So, but thank you so much. I'm excited to be in Orlando and just spread more about oral health, the information. I think again, we need to get the mouth back into the body. It's the gateway to our health. I think we're learning it's more important than we've ever realized. And so thank you for the opportunity. I really appreciate it.
Yes, the pleasure was all ours. Thank you so much for being here. We'll look forward to seeing you in a few weeks. Thanks, Staci.
Thank you.